cover an actually common topic. We will talk about the guys that get testosterone products oftentimes at the gym. They get them in order to boost their muscles, to enhance performance, elevate the mood or overall well-being. They do those therapies, which is absolutely outside the medical guidance, is through intermittent cycling. So basically it's when you give yourself testosterone for 8 to 16 weeks and then you do a drug-free interval. Second is basically a testosterone replacement therapy, which is at way higher doses that we would usually use. So it will be around 150 to 300 milligrams of testosterone per week. And number 3, it's what we know, it's called blast and cruise protocol cycles, followed by lower maintenance dosing, and de facto it actually leads to prolonged suppression of your own testosterone production from the testes. So why should you even bother? If this is giving you all those benefits for your overall well-being and for your muscles, why you should even bother to listen to what I'm talking about? Well, recent estimates suggest that the global lifetime prevalence of testosterone abuse is high. It's at 6.4 for men and it's at 1.6 for women. And what we also are noticing that not only young men who are visiting the gym are coming to seek for testosterone replacement, but also older men are attracted to testosterone replacement therapy for its proposed positive effects on their energy, on their mood, or even on their sexual performance. And there are plenty of commercial testosterone clinics who often prescribe quite high doses of testosterone to men who actually do not have a diagnosis of testosterone deficiency. And on the other hand, when we as endocrinologists refuse to prescribe testosterone in the absence of a medical diagnosis of testosterone deficiency, a medical indication, lots of patients actually turn to internet sources and self-initiate treatment and seek guidance through online forums. And those online forums, we now know, tend to promote way too high dosing regimens of testosterone. And what happens then? What happens to your body when you actually overuse testosterone? You get acne, you get gynecomastia, so your breasts are increased. And actually the one thing many men do not consider and do not know of, that their own testes shrink. The mood changes and the blood pressure goes up. What are the other more positive effects are obviously the enhanced libido and oftentimes also elevated mood. What do you see when you go for a blood test check? You see raised erythrocytes, you see oftentimes high lipids, and you see also high liver function tests. What happens to your heart? It's really significant. We now know that it causes your heart, especially the left chamber of your heart, to grow, and that impairs actually the pumping ability of your heart, and that increases your risk for a sudden cardiac death if you're a bodybuilder. We also know that after discontinuation of the testosterone therapy, most of the short-term effects that I mentioned resolve within a few months. But if you've been using testosterone for many months, your endogenous testosterone production might not return back to the normal once you stop testosterone treatment. And what happens then? You basically then are testosterone deficient because your own testes no longer produced enough testosterone. And that can lead to symptoms such as feeling tired, your libido actually goes down, you feel depressed, and it might take a long time for the testosterone, your own endogenous testosterone production, to recover from the supraphysiological doses of testosterone you've been giving yourself. So what is actually most concerning? What should be most concerning to you when you go online or you buy the testosterone product at the gym? I think you should definitely think about your heart and think about the fact that most people die of cardiovascular problems. We know now that people who use testosterone in a supraphysiological dosing, meaning for doping, have increased risk and higher rates of premature atherosclerosis, heart attack, arrhythmias, and also heart failure. And this is, we believe this is because your blood pressure goes up, your lipids go up, your erythrocytes erythrocytes go up, and also there are changes on your blood vessel walls due to doping with testosterone. And the interesting thing is that the cardiovascular risk actually correlates quite clearly with the cumulative androgen exposure, meaning the longer you use testosterone for doping, the more likely you are to develop those problems. But here's the good point as well. Many side effects of testosterone abuse, including also the cardiac changes, appear to be reversible after discontinuation. But clinical recovery and clinical improvement doesn't necessarily imply full recovery. It is a very complex issue. So even if you go for a blood checks and imaging checks, those results can actually, we know now, can actually give you a misleading impression that all is safe and you can continue with the testosterone treatment. So if you right now are at this point that you are purchasing testosterone products online, you're getting the testosterone products at your gym, please do seek endocrine help. We're here to help you, we're here to guide you, and we're here to support you. If you liked what you just saw, if you have a friend who would benefit from watching this, follow for more and share this video.